The other top story we're following tonight, the booster shot rollout coming soon to hundreds of thousands of Nevadans. Good evening. I'm John Huck.
And I'm Jacqueline Schultz. A CDC panel tonight giving the green light for the third shot for Pfizer. The panel says the booster should be given 6 months after the first 2 doses to seniors 65 years and older, nursing home residents, and adults 50 to 64 with risky underlying health problems. So when can Nevadans get the shot? No date set just yet because, quote, Nevada will participate in the Western States Scientific Safety Review Work Group to evaluate the recommendations. And that's all according to the Nevada Department of Health and Human Services tonight. Some groups expected to be eligible were left off the list. Many workers whose jobs put them at risk will now be left in limbo.
I'm definitely concerned. My school has had positive cases. Part of me would like that security blanket.
Lenny Lither is a special education teacher at CCSD with asthma and an immune deficiency. He may consider a booster shot for his health, but the CDC says other teachers will have to wait. A CDC panel Thursday said the data was clear. Who needs a booster now and first? Seniors and adults with underlying health conditions. The panel rejected the Food and Drug Administration's goal to give boosters to workers with high COVID exposure, from healthcare workers, nursing home workers, teachers, and grocery store workers, asking for more data first.
And there are teachers that are definitely worried, especially those with underlying conditions.
For the 65 and older, after 6 months, we start seeing a decline in the immunity. There are individuals who are younger than 65 that have medical conditions. If you're not somebody who's young, otherwise healthy, you may need a booster dose.
Dr. Christina Madison of Roseman University of Health Sciences and the public health pharmacist says the CDC outlines a list of conditions that put you at risk of severe COVID infection. They include dementia, diabetes, obesity, kidney disease, smoking. If you're asking, should I get a booster?
If you have a primary care provider, then I would specifically go to your primary care doctor because they know your medical history. Then the next place I would go is go and talk with your pharmacist.
The Southern Nevada Health District says so far there's enough vaccines for everyone who needs a booster and can ramp up capacity as needed.